Hello, everyone. It is your girl, Marcie Thomas, and I am so happy to be here with you this evening. So come on in the room, let me know that you're here, and we're going to have a really important conversation. So if you're here live, that's even more special. Well, if you're catching it in the replay, please just let us know that you had an opportunity to tap into the conversation that we're going to have tonight. So if this is your first time here, as I said, I'm Marcie Thomas, founder of Brown Girl Collective and Live Well Sister, which really is a space for us to come together and talk about things that are important to us in order for us to live our best lives. And that shows up in a lot of ways, whether it's our spirituality, our relationships with others, our personal health, and so on. So that's what this is all about. And tonight's conversation is especially important because it has to do with maternal health. And of course, whether you are a mother or want to be mother or have mothers in your life, it's just a real important conversation that we are going to have so we can make sure that the needs of Black mothers in particular are being attended to. So our special guest for this evening is Dr. Monique Rainford, who is a board certified obstetrician and gynecologist with over 20 years of experience. She's an award-winning graduate of the University of Pennsylvania and Harvard Medical School, and she is currently an assistant professor at Yale Medicine. Her writing about maternal and other health disparities experienced by Black women has been featured in multiple publications, including Afro, Elephant Journal, and the Hartford Current, and her broader work to women's health and wellness has been featured in South Florida Times, my screen went out a little bit, the Baltimore Sun, Thought Catalog, and the Journal of Reproductive Medicine. She lives in Connecticut with her husband and beautiful 2 children, and she is the author of the newly released Pregnant While Black, Advancing Justice for Maternal Health in America. So without any further delay, welcome, Dr. Rainford.
Thank you. Thank you for having me here tonight.
Oh, yes, I am really happy that you were able to join us. I know we're a couple days away from Black Maternal Health Week, but we're close enough, and it's an important enough conversation that it should be had at any time.
Agree. It's not over yet.
It's not over yet. It's not over yet. So I guess just by means of getting into it, of course, I've had an opportunity to read the book, and what I love about it is you share your personal story. You share stories of people that on patients and things that you've dealt with. Then there's also a lot of things that you've actually taken the time to research. So it really does make for a very well-rounded, book. There's a lot of resources and things like that. So what was it that prompted you to want to write this particular book at this time?
So since about 2014, 2015 to 2016, I began to gain a better understanding of the health disparities that were faced by Black people in Black women. And I continued to gain more of the standing over the years. I have to go back and say, I recognized there was a disparity way back in medical school years before, but I was always told it was poverty. And because of different choices and different circumstances, I didn't investigate it at the time. However, I decided in my career, I went back to Jamaica where I grew up and came back in 2014. And shortly after I came back, within a couple of years after I came back, I read and heard more and more about these same disparities that I heard about like many years before, recognized it was a problem and was beginning to understand why. And so I started doing lots of work in that area. I started doing more research. I started writing. I did a TEDx talk, and my friends were familiar with the work I was doing. And one of my friends is an agent for books, and she suggested to me, would you like to write a book in this area? And interestingly enough, I started thinking about it because of a project another friend had like that same year. And so, I prepared the proposal. It took us a couple of years to find the right publisher in Broadleaf Books. And here we are.
Yes. And, we talked a few minutes before we got started, and just for those who, might want to pick up the book, and as you explained to me, it's not necessarily your typical like pregnancy guide, what to do when what to expect when you're expecting. It's not that type of book. Just so people can know, explain a little bit of what you told me, what it is and why it is versus that type of book.
So the very first book I wrote was actually a pregnancy guide. I was living in Jamaica. It was a pregnancy guide for Jamaican women. This book is not that. This book is a book to help Black pregnant women get all the support they need to have safe pregnancy in a country where they suffer terrible disparities. And so what it talks about are some of the barriers that they face, some of the causes for the disparities, some of the treatment that they receive, some of the poor outcomes that they undergo because of that poor treatment, and really information on how Black pregnant women can be supported better to have optimal pregnancy outcomes. And why, while there is information in terms of, well, this helps and this helps, is not in the kind of format that a pregnant woman will pick it up and read, because some of the stories are tough. Some of the stories are hard. The outcomes are often not good, because I really wanted people outside the Black community, broaden the Black community, to have gained a better understanding of the problems that Black pregnant women face and recognize it's not because of their individual behavior or their individual failures, but rather a system that's failing them. Mm-hmm. And that is not to say there's no personal part that as a Black pregnant woman we can play, or there's no personal responsibility, but there's only so much one can do as an individual. A system needs to support you. And I really wanted to emphasize in the book that the system needs to support Black pregnant women, and the community needs to support Black pregnant women so that they can have the best outcome in pregnancy possible.
Yes. And, even in the beginning of the book, I think I mentioned to you, I was talking to my mom about it because she always wants to know who are my guests and, what are you going to be talking about? But as I was reading, even in the very beginning, some of the things you were saying almost mirror a conversation I was having with one of my close friends just yesterday or the day before, when we were talking about a lot of times people will think, with people who live in a certain neighborhood or people who, grow up a certain way just don't want X, Y, Z, whatever it is, or they're just lazy about X, Y, and Z. But understanding that there are systems. There are things that have been set up in such a way that oftentimes people feel like they don't have a choice. Sometimes they don't have a choice, in certain matters. And I like the fact that you talk about that, because we have to understand that there are things that we may be dealing with just as Black people in America that impact the way that our lives shape up, that is not necessarily about, pulling yourself up by your bootstraps. People say that. Sometimes it's not just that.
It's way beyond that. And that is what I wanted to get across. It's way beyond that. And it doesn't negate personal responsibility. It's just that, it's been said, well, how can you pull yourself up by the bootstraps if you don't have any boots?
Right.
And that is really, what's about. For Black pregnant women to have optimal health, there needs to be more support put in place so that that can be possible. Without that, they can still try the very best they can do and still be failed by the system. And that's why I highlighted some of the stories I did in the book, because these were affluent Black women who were doing everything right, and the system still failed them.
Mm-hmm. Mm-hmm. Yes. Now, the book has several chapters, and there's no way we could get into everything in the time that we have available. But I did want to kind of talk about some of the things that really stand out to me, either because we've heard stories similar in the media, or, like you mentioned, some of these celebrities or whatever, but then also just things that I know that as Black women in my family or in my community, I've seen them go through. In one of the earliest chapters, you do talk about infertility. and Black women and infertility, and how it shows up differently with Black women, or what options may be a little bit different for Black women than it is for non-Black women. So talk a little bit about that, please.
So first of all, for the wealth, because of the wealth gap that was again created outside the Black community, but because of circumstances that we all know in history has happened, many Black women out there who want to have a child don't have access to optimal infertility treatment because Medicaid covers limited treatment. So that's one barrier. And even if Black women have access to the insurance that will allow them to have treatment, they may not have the knowledge, or they may not be comfortable asking. And also, even within the community, is often something that traditionally, that's changing, was not discussed openly. But at the same time, a Black woman would be asked, she gets married, and when are you having a baby?
Yes.
You know, a lot of women are asked that, I imagine, even outside the Black community. And then she could be desperately trying, doing everything she can, and it's not happening. And she may not even have the knowledge to know where to go for help, because it's not talked about in the community, or it was not at the time.
Right.
And her physician may not bring it up to say, oh, is this something you want to talk about? Or obstetrician and gynecologist may not talk about her fertility planning with her. So she doesn't know where to turn. And she may try for years and years until it's almost too late to get the help she needs. So it's a troubling struggle. It is changing. There's more conversation. More people are being open about it, as I mentioned in the book. And I think that will help. But still, Black women, even if they have resources, are not seeking the help they need as much as, say, white women. And many Black women who want help don't have the resources or type of insurance that will get them all the help that they need. And that's unfortunate.
It is, because, just think about the women who want to have children who aren't able for whatever reason, and knowing that, a lot of times there is information, but they don't have access to it. Or even sometimes, you talk about this a lot, even if maybe they do go to a physician, number one, there aren't that many Black obstetricians. There aren't a whole lot of you out there, for one, or you're just Black or people of color that they may feel like they can relate to, or feel more comfortable with, or be able to trust. And then the thing that you talk about is bias. So even if they go to someone who maybe could help them, that their biases might keep them from actually helping them.
Yes. And remember, this is not necessarily overt biases that you can recognize, or the person can recognize. This is implicit or unconscious bias. And these are people who genuinely mean well, genuinely want to help the person, but because of biases baked in from years of talking about the inferiority of Black people and hearing about that, they are not giving Black women the same level and quality of care as they would, say, a white woman. And so they may fail to mention some of these important things that they may have mentioned to their white patients. For example, in regarding fertility, or regarding that discussion about, what are your plans? Mm-hmm. Or they may feel uncomfortable because that lack of discomfort, bias is not understanding, and they may feel uncomfortable bringing it up in their Black patients in a way they may not have felt. They may not feel uncomfortable with their white patients, or the patients of the same race, depending on the race of the doctor.
Mm-hmm, mm-hmm. That is something. And now you are from Jamaica. I hear a little bit of it in it, just a teeny tiny bit. But you also talk about that, which I thought was really interesting. The fact that you may have women who say, like yourself, coming from the Caribbean, or coming from Africa, or other parts of the diaspora, that oftentimes things may be even different with them in terms of their health outcomes as expectant mothers than even they are with African American women who were born and raised here. I found that very interesting.
So in terms of certain birth outcomes, in terms of one birth outcome I'll describe in how well a baby grows in the womb. The growth of a baby, if a baby doesn't grow well, that can lead to something called low birth weight, where the baby is basically born smaller than the baby should be. So the interesting thing about that is that if a woman from Africa, one of the countries in Africa, or for the Caribbean, come to America. So they grew up in the other country, they come to America and have their babies in America. Their babies grow better in the womb than of an African American baby in an African American mother. But the more time they spend in the country, and really after generations, so say they come from another country, they have their babies who grow well in the womb, then they have their daughter, and that daughter has a child, that baby does not grow as well anymore. Mm. That Jamaican American baby does not grow as well anymore. That, I say, Nigerian American baby does not grow as well anymore. So that just being in this country as a Black person and being subject to all the racism, I would say, that Black people experience, that affects how babies grow in the womb.
Mm-hmm. Yes, and that was something I found like, wow. So it's not just the fact that we are quote unquote Black, it's a thing about being Black in America. Black in America. One of the things, a couple of things you talk about specifically, and I had someone on a couple of weeks ago, the book Before the Streetlights Come On, we were talking about environment and climate change. And I something that I never knew that you talk about, that your environment, your physical environment can play a factor in whether or not, the baby is brought to term or grows and all these sorts of things. So just talk a little bit about that, because I was very like, wow, that thought never crossed my mind.
In terms of environment, pollution, for example, pollution can affect miscarriage rate. Some of the studies show pollution can affect number of fibroids, which can affect infertility. For example, environment in terms of food a woman consumes or have access to in pregnancy affects the growth of the baby in the womb. So if a woman does not have access to, or is not knowledgeable and educated of the importance of healthy food, and so she does not consume it in the pregnancy, that can have a negative effect on the growth of her baby in the womb. And the babies are less likely to grow healthily if she consumes a typical Western diet or the typical foods that many Black women in low-income communities have access to fast foods, but they don't have access to the healthy foods. And that's a problem. Or if it's there, then they tend to be more expensive. So It's still inaccessible in one way or the other.
Mm-hmm. So, like I said, these are things you don't think about, but it all makes sense. If you're breathing dirty air and you can't get good, clean food, that would play a factor in, the being able to, carry a child. Another thing is, we talk a lot about preeclampsia, which is a form of high blood pressure, and that impacts Black women more than, other races.
Yes. So Black women come into pregnancy with more risk factors for reasons I discussed at length throughout the book. And also in pregnancy, they're also more likely to develop preeclampsia, even if they didn't have any risk factors. And that is probably likely related to the stressors, but it's also related to dietary issues, and probably related to, again, what they have to undergo while being pregnant in terms of how they're treated, how they're not being supported as well as they need to be. And when they develop it, or if they develop it, they may not be diagnosed quickly enough to prevent really bad outcome, really bad circumstance, because preeclampsia is something that is important to be diagnosed in a timely manner, so you can be monitored carefully to try to protect both you as the pregnant woman and the baby, to protect both mother and baby. And if one or the other falls down, then there can be, frankly, deadly consequences.
Yes. And which is really unfortunate that people aren't finding out. But as we kind of mentioned briefly before, it isn't, I know we're talking a lot about the disparities because of maybe people, environment and things like that, but it's not just because a person may be in a quote unquote low income area. That's not the only reason why these things can happen. Even wealthy women, we've heard like Serena Williams, Beyonce, others who have experienced certain things when they were pregnant, even though they had all the resources. So obviously, it's about more than just the fact that of how much money you have or don't have, or if you're on Medicaid or whatever the case may be.
Yeah, I've heard too many stories like Serena, where if Black women, Black pregnant women don't advocate for themselves, or even if they advocate for themselves, they're sometimes ignored. And so that's disturbing. They say they have a problem and it's not taken seriously enough, it's not investigated seriously enough. Their concerns are dismissed. And as I mentioned, it can lead to sometimes deadly consequences. Thankfully, for some people, when they advocate for their health, bad outcome can be avoided and has been avoided. For some people, despite the advocacy, despite trying to do their very best and ask for help, they didn't get the help that they need. So, and yes, it's not just a problem of poverty in any stretch of the imagination. It's well beyond that, because Black women of any socioeconomic status, even the highest, like Serena, can be ignored or not listened to and have to advocate and advocate and advocate. And thankfully she did, and thankfully she knew what the problem was, right? She knew what the likely problem could have been, so she knew what to tell them what to do. And so a Black woman may have a similar problem, a Black pregnant woman, and they don't really know what's causing the problem. All they need is help, and they shouldn't really have to know, right? They shouldn't have to
Right.
know, but
Right.
they don't know, and they don't know what to ask for, and it's not done. And the consequences can be deadly if the right intervention is not done in a timely manner, and has been deadly for, frankly, too many Black women.
Yes, which is unfortunate. But as you were talking about that, it really made me think about the importance of this book and the people that are in that woman's circle, or the people who are there to support her. Because, well, as you talk about in the book, support helps a lot in a lot of ways anyway, for a variety of reasons. But then just the fact that sometimes a woman might not know what questions to ask. So how important is it for those who are, standing with the pregnant women, or, a woman, and we're trying to help her and things like that? How important is it for us to really kind of stand with her and be supportive?
I think that's vital. I think that the village of the community around the woman, the village, is highly important. I think her loved ones, her friends, they can read the book. They can know the things that she needs to look out for, and they can help her if she shares, this is going on. They can help her with her advocacy. They can help share their knowledge with her. And yes, there are books that are designed for her to read, which is also helpful, but the village can really step up and be that person. And, one of the stories I described in my book, where one of the people in my book needed an epidural, and she had her village there. She had a friend there. When they did not want to give her epidural because she was on Medicaid, her friend made sure she got that epidural, advocated for her, and made sure she got the help she needed. So that village, that support, is extremely important. And I also advocate, as you well know in the book, for doula support.
Yes.
I really think that every Black woman should have a doula, a good doula who supports them. Not just any doula, but a doula who really supports them and is kind of aligned with their wishes, so that to help them navigate the journey of pregnancy and the postpartum period better.
So, because you are an actual provider, how does the doula kind of step in and talk to you directly, or the three of you work? Would the three of you work together, or how does that work? I told you up front, I don't have any kids, so I don't know personally. But how does a doula kind of work alongside with the medical practitioners?
So the doula sometimes is in the birth room with the patient, and they are really addressing the patient. Their role is not to step in and make medical decisions, but support the patients in their medical decisions. And I'll talk about the most recent experience. It was a couple of years ago, because I don't deliver currently, but it was during the pandemic, and the couple had the doula on the phone. And so when I said something, they kind of double checked to make sure it was the doula thought it was a good idea. And I appreciated that, in the sense that it was interesting in a way, but I love the fact that they had that support. They had someone who was kind of in the background, kind of helping them and supporting them. And I must admit, when I was first exposed to doulas years ago, I thought like, oh, doulas would interfere with the care that OBGYNs would give. And I realized that that's not it. Their role is to support the pregnant woman, help the pregnant woman say things that they may not feel comfortable in saying, sometimes keeping the pregnant woman calm throughout the process. So it's very important that it's a team approach to caring for the pregnant person. And so it's important that the doula supports the pregnant person first and foremost, and then through that support, they can know what needs to communicate if the pregnant woman is not able to communicate those needs herself. Their job is not to make management decisions or make medical decisions. Their job is really a support person.
Gotcha. And that's good to know. And I guess, women can use that extra support because there are a lot of things going on. And, the dad might be there, some cases not. But if the father is in the picture, there's maybe things that he doesn't know. But it's nice to have that extra support, part of that support system. Of course, speaking of systems, of course, we have people like you who are out here and, spreading the news and letting people know what needs to be done or ways that we can help Black women specifically. But there's certain systems that have to change as well in that, medical systems or, making things available to people. How has your work or how is your work impacting people that are part of those systems?
Well, I certainly hope my work will impact those systems more, but it's early. The book has just come out, and I'm continuing to do work in that area. So, but I know it will take time to see the impact of the work. All I can say is I'm committed to continuing to do the work to help effect positive change for the experience and the actual outcome for Black pregnant mothers and their babies.
Yes. And you're moving in the right direction. You got to start somewhere. But it's just the thing that, we know, like, I think back to when people were wanting to get the right to vote. Yes, people have an idea and folks have to kind of rally together and launch onto that idea. And then more and more people start to speak up and speak out about it. And then that brings things to, a place where things can be better. Legislatively and otherwise, or in hospital systems and things like that. Because one thing you do say in the book, and we know it's true in terms of people with biases or prejudice or racism, is not necessarily going to go away. It won't go away. But if we have certain systems in place to make sure that people are getting the care that they need, that helps.
Yes, that helps. And so, yes, the racism won't go away. Some people with implicit bias, they can do the work and discover what it is and improve the care they deliver to pregnant women, pregnant mothers. But not everything is going to go away. And so we need systems in place so that in spite of that, Black pregnant patients can have good outcome.
In the book, you also talk about, of course, there are things that can happen, before. There are women that, have miscarriages. There are women who may have babies that, come too early, or even, cases where a child is stillborn. And some of the things that we've already talked about can lead to that. But it goes back to that care that they're getting along the way and people listening or paying attention when they see things that might be a little out of order.
Yeah, the care. And so in terms of stillbirth, as you read in the book, one of the times that Black women have a higher incidence of stillbirth and a disparity in stillbirth is at 39 weeks of pregnancy. The problem with that is that a baby could be safely delivered before that and not have any problems. A baby can survive well when 39 weeks is full term, baby's ready. And so what I said in the book, why is it that some Black women who need to be induced at 39 weeks aren't being induced. And then on the other hand, I hear stories of Black women say they were induced and they didn't get an explanation. So you
Mm.
wonder, are some of them being induced when they didn't need to be, and some that needed to be induced didn't get the induction they needed? But certainly it appears from the literature that some of them who needed to be induced, which could have potentially protected against a bad outcome, did not get an induction, and then their babies died before they were born.
Which is unfortunate, to think of the mothers who go, families really, but the mother that's carrying the child, to have to experience that, and even the things when it's something that could be preventable.
When it's something that could be preventable. And I'm not saying here that we can prevent every stillbirth. We can't. There are accidents that happen, something like even a cord accident, where they think that the cord may have suffocated the baby in utero and things like that. I've seen situations where people come in for stillbirth and we just didn't have any warning. Just didn't have any warning. And so we couldn't prevent it. And that will still happen. What we want to address is the things that we could prevent. We can't prevent every bad outcome. We just cannot. We're not gods. We're not God. Right. But we can prevent way more than we are now. And when they look at the most recent maternal mortality statistics that are out there, when I wrote the book and the research that I had read, it was 60% was preventable. Right now, it's 80% that we're finding from more of the research and of the available information. So clearly, we have so much more work to be done. Clearly, we are not doing all we can do. Clearly, we're not doing enough.
And when you say we, of course, you mean people that are in the medical profession, but then you're talking about advocacy as well?
I mean institutions. I mean politicians. I don't mean just physicians. I mean all of us in America who are here to support Black pregnant women. In terms of is the village doing enough even in terms of support? But I don't really mean the village in this sense. I mean more institutional policies, healthcare clinicians. That's who I talk about when I say the we in this case.
Yes, because I'm just thinking there's so much and there's so many pieces to the puzzle. In the book, you talk about a lot of the pieces to that puzzle, and just, I don't know. I mean, it's the whole thing of, because it's such a wide range of things. It's, the fact of, being able to get pregnant, some of the infertility issues, do you carry the child to term? Is the child healthy? Does the child survive once the child is born? But you're also talking in this book about things that are specific to the mother, not just the baby, but the mother herself. So, whether it's, is her mental state right? Because we hear a lot of things about postpartum depression and, different things like that, but then even her physical body. So talk a little bit about the things that are like more support of the mom outside of, just the baby, his or herself.
So we have to remember that when we're taking care of a pregnant person, we're taking care of the mommy and the baby. But we should not be taking care of the baby at the expense of the mommy. The mommy needs to be in good shape so that she can have the best outcome for the baby. And sometimes the focus is on even delivering the baby, making sure the baby's safe, which is important, but ignoring the mother. And so after delivery, the baby is healthy, but then what happens to the mother when she goes home? Does she have enough support? Does she have enough postnatal visits, post-pregnancy visits, postpartum visits? Does she have enough of a village at home to support her? Or can anything be done? Is she getting enough, all the appointments she needs? Is she getting access to insurance? And that's improving after the birth so that she can get the care she needs. So we have to really remember that in trying to do our best for the baby, we need to do our best for the mommy too, for the mother as well. We need to do our best for both throughout, not just leading up to the birth, but post-delivery.
Yes, because there's a story, and you mentioned it in the book. I know it's Judge Glenda Hatchett, her son, and I had heard the story before I saw it in the book, but her son, his wife, went through some things after having the baby and ultimately passed away.
Charles Johnson, her husband, is a tremendous advocate. And that was within the birthing hospitalization. So she didn't even get to make it home. She had a surgery. She had a complication post surgery. He noticed that there was something wrong. He advocated over and over and over again to get help. And by the time they intervened, it was just too late. And they took her to the operating room. She died. So that's an example of someone with affluence, someone who was healthy, someone with the right circumstance, someone with even someone to advocate for them. And they didn't have the right outcome because of biases. And Mr. Johnson attributes it to racism. He believes that that was a factor that affected the outcome of his wife, why his wife died. So it's really, that's a terribly sad story, as you know, terribly sad story, and terribly sad outcome. Really, when you read it, when I look at it, it just didn't need to be that way. The complication could have happened, but why did it take so long for her to get help? And I wasn't there. I don't know the circumstance of the hospitals. I have to qualify that.
Right.
But just looking at it and reading the story, it doesn't sit right or feel right to me.
Mm-hmm. It definitely doesn't, to think that someone could have helped and, for whatever reason, chose not to. You do mention that in some cases there may not be enough people to help, enough physicians, enough medical professionals to help. We already know there's not a lot of people that look like you. We know that. But just in general, is this something that a lot of people are not going into the field, or what do you think that is?
I think people are exiting the field prematurely. I know that pretty much for sure, based on the research and even talking to many colleagues. Many of us are not staying in the field as long as yesteryear, where people would probably stay in the field their whole career and then retire, or stay in the field, frankly, until they die, their whole career. Many are leaving the field early. And you've probably heard that that's true for nurses.
Right.
That's true for other physicians in other specialties. So that's part of the problem. New OB-GYNs are being trained, but of course, not everybody does obstetrics. Some people focus on fertility or oncology, where they take care of GYN oncology, cancer cases, gynecological cancer cases, or high-risk obstetrics, where yes, they do obstetrics, but they don't necessarily deliver, and they take care of high-risk pregnancies. So all those factors play in to why there's not enough obstetricians, and there are not enough obstetricians, and that problem is actually getting worse. And there are not enough midwives, but the midwife problem, in terms of that, should improve because more and more midwives are being trained. So futuristically speaking, based on the research, there's expected to be more than enough midwives, but still not enough obstetricians in a few years, which I talked about in my book.
Yes, it's funny because midwives were on the tip of my tongue. So I'm glad you said that, that they, there are people who are doing that. And really, women do have options for delivery. Of course, there are the things that need to take place in the space of, a hospital or under, the guidance of, professionals such as yourself, but then there are women who have children at the house, water births and, all other sorts of things. So I guess, there are people who are still bringing babies into the world, because that's not going to stop. But just having those professionals who can, perhaps help in those areas where people really need that help.
Yes, often for reasons, as I outlined in the book, Black pregnant women may be at higher risk, so they need more support. And their risks may not allow them to deliver in a low risk setting, like say a birthing center. They may need to deliver at a hospital. but the hospital where they live at needs to be adequately resourced to take care of them. And which I highlight in the book, some of the hospitals which which service predominantly Black women have the worst outcome. And
Mm,
that could be related to resources. It could be related to other reasons as well. But that's disturbing. And worse outcome, whether the person is Black or white. So there's something with the hospital, that hospital system. Again, it could be related to resources, but it's something with that hospital system in itself. So that's where a Black woman goes to, and where she goes to, there's a problem with the care at that location. And plus, she may have other risk, or if she didn't have much risk, she could develop risk within the system, and that can lead to the poor outcome.
mm, mm. Which is really unfortunate. In the book, you do also talk about mental health and how sometimes on many occasions people don't really look into that. 'Cause I mentioned briefly about postpartum depression, that's something that happens, but sometimes that whatever the mental health challenge can go beyond just what we may think of as a postpartum depression, but women aren't getting help for that either because maybe the stigma in our community about mental health, and or people just aren't recognizing that could be what it is.
That's an example of something that has been put in place to allow more recognition. So, the screening of pregnant women in pregnancy and postpartum for mental health, depression screening, has been very helpful in helping us to identify which women need help. However, the resources to help them are still lacking, and there's still lacking of therapists, lacking of psychiatrists, lacking of culturally sensitive therapists,
Right.
for example, because the woman, and unfortunately sometimes for very good reason, Black women may not feel comfortable going to a white therapist because this is very personal, this is very important, and if there's a bias against her and her care is compromised because of that bias, then it probably could lead her to a worse place than she would have been otherwise. So that is some of the problem, or those are some of the problems that Black women with mental health disorders can encounter. They may be screened, it may be identified. However, where do they go for the support they need? Or they may be unwilling or reluctant to share it because they do not trust the system, that the system will take care of them with that problem.
Mm-hmm. That is so true. And you mentioned that I'm not currently going to a therapist because therapy is good for everybody. But every therapist that I've ever had has always been a Black woman. I specifically seek that out. Not to say that someone else might not be good. It could be a Black male. It could be, someone of another race that might really be good. But there's some things that I just want to be able to have those conversations and not feel like I have to educate while I'm talking about whatever's going on with me. So, I do see a lot more people are going into that mental health space, but, as you're saying, it's still not enough.
Not enough, not yet.
Not yet. So, in terms of things that we can do, of course, your book gives a whole lot of ideas that people that are in the profession can work on. I do know that there are currently some legislations out there to try to help make things better. What is it? What are some of those things? And how can we really stand up and advocate for Black women and their maternal health?
So I speak to the Black women who are considering pregnancy or are pregnant. Let's speak to the Black women who are considering pregnancy. They should try to get preconception care. Not try, they should get preconception care, meaning see a clinician before they get pregnant so they know how to optimize their health before pregnancy. For example, if they have high blood pressure, so it can be well controlled with medications that will be safe to continue in pregnancy. So they need to be upfront that say they're trying. If they have diabetes, that should be well controlled before pregnancy. They also want to try to do their best to live that healthy lifestyle, which does can improve outcome, lots of evidence. So pay attention to eating healthy foods, pay attention to exercise, pay attention to stress reduction. And we want their community to support them. So your friends, if you have pregnant women who are your friends, how can you support them? How it could be like, okay, I know you want to walk to get ready for your pregnancy or during your pregnancy. I'll walk with you. So you don't have to do it alone. Or I know you can't cook tonight, but I'm cooking tonight and I'm cooking something healthy. Can I share some of what I have with you, for example? That support is important. And yes, thankfully, there's more policy being made or trying to be made, being
Right.
advocated through Congress. For example, a couple of years ago, they signed the act that allowed for the establishment of maternal mortality review committees. And the
Mhm.
establishment of those committees allow us to know that it's not 60% of deaths are preventable, but 80%, as I mentioned earlier. So the advocacy work is vital. And thankfully, there are advocates, strong advocates in Congress who are fighting and working hard to protect maternal health and to protect Black maternal health and to protect the health of anyone who's underserved and all pregnant women.
That's so true. And when people, this is just my 2 cents. When people are experiencing things, to speak up. I know sometimes it's hard, but oftentimes if you start to tell your story, and then people say, there might be somebody else who has a similar story, and enough of those people coming together and telling those stories, and banging down, knocking on the doors, and letting people know what's really going on, that plays a factor. And as you said, these things don't happen overnight, but just being able to do that, and talk about what's going on as you're doing, through this book.
And sharing the stories, like you said, are so important. For example, if a Black woman shared with even a friend, was able to share with even a friend that a fertility struggle and what she did, then that friend who may be going through the same thing would have more information. If she shared more of different things in pregnancy, or maybe her sharing will allow someone to feel brave enough to admit, wow, I'm having that problem too. And then the courage of women who are sharing their stories, like Serena sharing their stories, more women could step up and say, wow, I had a hard time too. And this is what I had to do. And this knowledge, it just brings more knowledge to women as they face pregnancy. And that is just so helpful, I think, to overall move the needle to improve outcomes. So I think that sharing is so important. And I know some things, as individuals, we don't want to share, we don't feel comfortable. But I hope that we will share even a little bit more for the sake of others. And I've seen people being brave enough to share a little bit more than they may have otherwise for the sake of others. And that is tremendously helpful to advance the care, to improve the care for Black pregnant women.
Mm-hmm. As you were saying that, I was just thinking about the fact that, we in this modern society oftentimes hold things close to the vest, or we don't, talk about what's going on. I mean, well, of course, you got the people who overshare, you got those. But then there are people who really don't talk about, because they're afraid of a judgment or a stigma, or, whatever the case may be. But as you were talking, what I was picturing in my mind, the village, and how historically, whether it was during periods of enslavement, or when we were in our native lands, or the land that became our native land, like in the Caribbean and things like that, how women did kind of bond together and support one another in motherhood and child rearing and all of these sorts of things. And it's not to say that bad things didn't happen even then, but there was a support system that I think is important.
I want to add, I was reading recently that you may know that the outcome for Hispanic women, well, at least before 2021, was better than even white women. And I was reading recently in the reasons for that, and the social support and community support was listed as a very important reason. So that community and that social support really can change things and improve outcome. And as you know, I mentioned in the book, Black women in America are losing a lot of that community over time. And so we need to rebuild that community so that we can support the pregnant patients, the pregnant women.
Yes, the pregnant women, the new mommies, all of that. Because I know in the book you do talk about some of the different groups that are doing things, whether it's helping mothers with, if they're going to breastfeed, helping them to understand that and kind of walking them through that process. I can't think of her name right now, but you mentioned her, the young lady who started Earth, IRTH. I can't think of her name, but I know who it is. But it's like, it is, stuff like that is just important.
Important. And like you said, when I talk about the pregnant women, I mean in my mind pregnant and postpartum women, but I need to say it. I mean, not just don't stop when she has a baby. Oh, how's the baby? Remember her. And someone brought to mind that when they visit someone after, they don't just ask about the baby, they ask about the mom. Both are very important. Both are critical throughout the whole time, during the pregnancy and after the pregnancy. And we don't want to forget our moms. And the person that I spoke about in the book is Cheyenne Devotion, who is a doula. She does doula training, or was doing doula training in Connecticut. And she went back to midwifery school. I don't know if she's done yet, but she's been a tremendous advocate and just doing a lot of work, recognizing that Black women need more support and doing her part, which is a big part, to improve the resources so they have more people to support them.
That support. There is a young lady here who has a business on the wall, Black woman. It says support is a verb. So support requires action. And I mean, even in this space, just to have these types of conversations, to have a conversation with this book, if you are a person who knows someone who works in, the medical field, to share this with them, because there are things that they can learn, possibly about ways that, things that they can bring up. Because I think that's important as well, to have people like you. I know you say you're not in the delivery space now, but to have people who are in the space who are willing to speak up and speak out.
Yes, that's always important. And just bringing more knowledge and also bringing more empathy to the discussion, and really trying to understand what the experience is like as best you can of what it's like to be a Black pregnant woman in America, and what you can do as a clinician or as any individual to help make that experience better.
And unfortunately, I did not capture this young lady's name, but there is a video going around on Instagram right now. It might have started on TikTok, but it's actually a young white woman who works in like an OBGYN space in a hospital. And she does this long spiel about how she does not practice colorblind services. She understands that Black women need certain things, and she, goes into all the stuff, certain things. So she's like, no, I don't treat my Black patients like I do my white patients, because I understand that, they may not trust me. I understand that sometimes people won't listen to them. So I do give them, an extra level of care, because I understand that they need it, because there are others who may not want to listen to what they have to say and things like that. So I thought it was powerful that she got on, use social media to let people know, like, no, it's not just about being colorblind and treating everybody the same. There are those instances where you do need to tweak your normal way of doing things.
We can't treat everyone the same, because we're not all the same. We're different. Right. And so we have to respect those unique differences, like that young lady said, and meet a patient where they're at. The same. And we don't treat everyone the same, even if we say that, because we say, so the very fact that there is implicit bias means that we are not treating people the same. We're not giving people the same level of care, and we're not colorblind. So let's not pretend
Right.
Let's not pretend that there are not different races in America. Let's not pretend that everybody is treated equally. That's not the reality. So we need to meet patients where they're at and support them in the way they need to be supported on the clinician side. And frankly, on the clinician side, we need to learn how to do that. It may not be innate, it's not necessarily easy, but we need to learn how to do that. And that's part of why I wrote this book, to help educate clinicians as well, so that they can see what some of their blind spots may be and what they can do to try to improve the health they deliver, specifically in this case, the Black perinatal patients, pregnant and postpartum patients.
Mm-hmm, mm-hmm. And actually, believe it or not, our time is just about up. But I also wanted to say that I love that in the book you do tell parts of your story. And I love how you even got into this whole thing of being in medicine. You knew at a very, very young age, and was able to follow that through. So just real briefly, just tell us a little bit about that, because I found that very inspiring, just to know who you are and how you got to be Dr. Monique Rainford.
So when I was about 7, my brother and I were jumping on the bed. You know, you're not supposed to jump on the bed. We knew we weren't supposed to jump on the bed. Had a little accident and I busted my chin. And then we went to an urgent care. We live in Jamaica. And the doctor there, a Black doctor, is common in Jamaica, sutured my chin. And then he gave me what's called a 50-cent coin in Jamaica. And it was a lot of money back then. I'm like, I want to do that. I was just really moved and impressed and very excited about that 50-cent coin. I also had a Black pediatrician. I didn't talk about that in my book, but I admired her and I respected her and I looked up to her, and she also influenced me. I thought when I got to high school, which was 7th grade in Jamaica, that I would do other stuff. I thought about translating, I thought about law. And then when I was in 9th grade, I was about 13 or 14, my favorite teacher, my nun from elementary school, she was a principal, she died from cancer, and I was able to visit her before she died. And I remember saying, she wished she had more time. I remember that. And then I said, well, I didn't say well, but after that, I knew I had to go back into medicine. I thought I was going to, like probably many people do, find the cure for cancer, do something like that. I certainly have not been able to. And I did some work in that area early in my education, but have not stick to that area per se. But that motivated me to go back into medicine. And it was a birthing experience, a really beautiful birthing experience that made me choose OBGYN.
Yes, well, I love that, because how can I put it? Sometimes when a child says something, and the adults around them, whatever. But hey, if your child comes to you, or a child in your life comes to you and tells you that they're interested in something, and they, listen to what they're saying, because it might be serious. Sometimes they're just figuring it out, but sometimes it's real. And being able to follow that path and, have the support that you needed along the way to, a lot of it's talked about in the book. So we're in time's up anyway, but y'all have to read it to know the rest of the story. But I just wanted you to share that as well, since this is a space, for Black women, and being able to learn about, their health and maternal health and all that. Oh, thank you, doctor. We have another doctor in the room, Dr. Estelle Jean. Thank you for joining us. I think I told you before we came online that I had talked to a Black cardiologist before. That's her. That's Dr. Estelle Jean. So follow her on Instagram as well, because she gives a lot of great information about our heart health. So that's important. And of course, with the work that you do, sometimes the heart plays a role in what's going on with women in pregnancy as well. So
cardiologists are essential for the care of Black women, especially in the postpartum period. And I talked about that in the book. So Thank you for being here, Dr. Jean.
Yes. So, well, everyone, I do thank you for joining us. If you came in later, or, whatever the case may be, if you know anyone that can, benefit from this information, and I think we all can, to be honest with you, because we all, either you're having babies, somebody who's having babies, or whatever the case may be. And hey, we want to continue to be fruitful and multiply, and make sure that the children that are being conceived can make it here, and their mamas can be here to raise them. So it's just very important. This work is very important. So thank you, Dr. Rainford. As I said earlier on, I was really, chomping at the bit to have a chance to talk to you about this, especially as a woman who didn't have children. So some of these things I don't know from experience, but I'm able to learn, and there are things that I can share with others and be more supportive. Like, I do the March of Dimes walk every year. So now just understand a little bit more about that. So thank you for your work, and please continue. Well, I know you're going to have to tell you. Please continue to do the things that you're doing and putting the word out so that people can be aware.
And thank you for all your work in supporting and educating and shedding light on so many important issues. So thank you. Thank you for having me. I appreciate it.
Yes, absolutely. So I want you to hold on for 1 second, because actually next week I got another doctor coming in, but she's going to talk about something else. So don't hang up yet. Hold on. And I'm going to just share who the next week's guest is going to be. So next week I have, actually she's a friend of mine because she lives here in the Atlanta area. And our next week guest is going to be Dr. Kaylee Arnold. Now, the thing that's different about Dr. Kaylee Arnold is she is not currently practicing. She decided she wanted to do something different. And so she has opened up a yoga and Pilates studio here in the Atlanta area, SETI Yoga and Wellness. And she actually just graduated with a degree in, I always mess up the word, Ayurvedic medicine. So she's going to come on next week to talk to us about her new journey away from traditional medicine and getting into some different healing modalities. So I am really looking forward to talking to her. And like I said, she's my friend. I've been to her yoga studio a few times. So I really am looking forward to that conversation as well. So once again, everyone, thank you for joining. Please share this out for people who need to get this information, which in my opinion is some of everybody. And, I really do look forward to seeing you again here real soon. So in the meantime, have a great week and continue to live well. Have a good one.